seen a lot of sniffling and sneezing around your house lately, you are certainly not alone.
Yeah, flu season could be peaking early this year. Here to talk more about that is Dr. Mandira Mehra from SSM Health. Good morning.
Good morning.
I know the newsroom is already sneezing like crazy. People are calling in sick. What's going on?
It's not just the newsroom. It's the hospitals, it's the schools. Some schools in the country have been shut down for a couple of days.
Oh, wow.
'Tis the season, and as you can tell, it's usually a happy season, but unfortunately this means a lot of travel, being in really close contact with friends and family, and what that means is this flu season is really ramping up right now. This is a unique year because this year influenza B has actually made an early start. By this time of the year, usually a couple of states have declared a high flu season. We're already looking at 12 to 15 states that are showing active high flu rates. So what that means is it's not too late. Go out, get your flu vaccine, do that healthy hand hygiene that we always talk about, good covering your mouth if you're sneezing and coughing, that kind of thing. And then we want to break some myths today about the flu. A lot of people say, well, you know, I got it last year. Do I really need the vaccine this year? You absolutely need the vaccine this year. Number one, that strain changes every year. Number two, you don't get protection year after year just because you had it previously. Number two, if you're a pregnant woman, a lot of pregnant women say, should I be getting this? I'm pregnant. Absolutely. You are probably higher risk than other people. You should be getting that flu vaccine. Basically, anyone over the age of 6 months should be getting this flu vaccine. Now, a lot of people say, well, I have babies, they're only one, they're only two. They're the highest risk this season to really be getting exposed to the flu. So if you're over 6 months of age, you should be getting this vaccine. Now, there are some exceptions to this, but definitely talk to your physician or your healthcare provider and say, am I a good candidate? Now, we all know we've had symptoms of the common cold. What's the difference between common cold symptoms and flu? And sometimes this can be really confusing. The flu often comes with symptoms of overall malaise, body ache. I mean, sometimes people describe it as more severe, not just a cough and a sneeze and you get better in a few days. The important thing is if you do have the flu, to really stay out of contact with people. And so if you do have travel plans, you want to suspend them for a little bit. If you are supposed to go into work, pushing that off, remembering that good hand hygiene. So soap and water for 15 seconds or more is the best thing you can do, or using an alcohol-based hand sanitizer. But let's not forget, it takes about 2 weeks for the vaccine to really kick in. So this is the time right before Christmas to get that vaccine, let that immunity kick in, so we're keeping our friends happy and healthy, our family happy and healthy, and ourselves.
Yeah, I can tell I've been washing my hands a lot because they've been getting really dry and crackly, especially with the cold too. But
yep, but 'tis the season, so let's keep it a happy, healthy season.
All right, Dr. Mehra, thank you very much.